Mummy makeover questions coming in. So, mummy makeovers, is it safe in the age 50 and over? 50 and over? That's young! Love angle. People often ask about age and surgery, and the thing that I say is it really matters on how you are, your fitness. With the days of saying surgery in a certain age are sort of gone really now. For any surgery, that includes, I used to do a lot of breast reconstruction in people who are like in their 70s, and it really comes down to fitness. From a medical point of view, it comes down to fitness. So if someone's young but not very fit and on lots of medication and not particularly fit for an anaesthetic, you'd probably say, look, you're not safe. But if someone's older and are fit, then you would be safe. So age in itself is not a criteria. And the other thing is we talk to people about the benefits and the risks so they can balance up within themselves. So it's up to you as well whether you think it's worth it. But certainly over 50 is nothing, love angle. Absolutely nothing, and absolutely no problem. And to be honest, often that's the sort of age, or in the older person who wants the sort of mummy makeover with a body, breast and abdominal reshaping. Does your mummy makeover include butt lift? Mummy makeover is a bit of a sort of. Can I like these? No, I can't. Is it? Oh God, I can pin it. No, sorry. But mummy makeover is a bit of a sort of catch-all term. It's not really a thing. You wouldn't put someone on the operating list for a mummy makeover. You wouldn't write mummy makeover, because what does that mean? So mummy makeover tends to mean a breast and an abdominal thing. It tends to be, obviously, the term is used for body recontouring following pregnancy, following having children. It's also following weight loss. So you don't have to have had children, although it's called mummy, because you can do breast and body things on men who've lost a lot of weight, or women who've lost a lot of weight who aren't mummies. But that's what the term is used for. But it's basically a body recontouring, and it's a combination of procedures. It can include butt lift. Butt lift's a bit controversial at the moment in terms of buttock augmentation. Butt lifts, like, what do you mean by butt lift? Buttock augmentation, certainly with fat grafting, is a bit frowned on at the moment, because there's been a lot of problems, particularly in America and overseas, with complications. We never really did it much here. We don't really do it at the clinic. So at my clinic, we don't really do butt lifts, buttock augmentations. But there's no reason why a mummy makeover couldn't involve a butt lift. The only problem with combining a butt lift with another type of surgery, particularly if you're doing a surgery for the abdomen or the breast, is positioning. One thing you've got to think of is on the operating table, a mummy makeover is quite a big op because you're doing breast and tummy, so it's quite a long procedure. If you're going to do something to the buttocks, if you're going to do something around the back, you have to turn the patient during the surgery, which makes it even longer operation. So I would, I think, oh God, that's quite a big op then if you're going to do a sort of tummy, breast and a buttock thing. But there's no reason why it can't. There's no sort of reason against that, but